From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
The largest healthcare information technology conference of the year is going on right now in Atlanta. Dr. Val Jones joins us now live from the convention center via Skype. And Val, you've got some examples of the latest technology on display there. First of all, great to have you here. Thanks for joining us.
It's exciting to be here, Dave. I'm not used to not being in the studio sitting next to you, but I scrounged up some pretty exciting devices from the Health ID conference here that I thought I'd give it a try to show you what they look like.
Okay, please do. What have you got?
Okay, so the first thing that I have is called the Panasonic Toughbook H1, and it looks like this. It's for nurses. You can actually drop this computer from a height of 6 feet and it can survive just fine. It's spill resistant, and it also has the ability to disinfect it when you wipe the screen. I don't know if you can see where my finger is wiping, but it actually shows up where you've wiped, so you know that you've gotten the entire screen cleaned and disinfected, so you don't share germs with other patients. I think that's a pretty cool feature.
It's a fabulous feature, and the fact that it is so technologically solid, that's a real that's a real plus, because dropping highly sensitive things like that is a problem. If you're going to spend all that much money, you don't want it to have it all go up in smoke when it falls once off a tray or something like that.
That's right, and when you have trauma coming in the ER, and you know you're running and racing to help people, and sometimes things fall on the floor. So the good news is with the Toughbook, it'll be still functional when you pick it back up again. I also found something that was really interesting. It's the GE V-Scan. If you can see this here, this is a pocket-sized ultrasound machine.
Amazing.
Isn't it amazing?
Yeah.
It's just this big, and your doctor can take it with him or her on house calls even. They can check your kidneys, you can check you for gallstones, and it's just a fabulous little device. It's this easy. You just open it like that and use this wand to check your body out. So it's amazing.
And that's replacing something that generally sits on a big cart. It's like a sort of a home computer size thing. Now,
that's right.
Is that thing going to be as accurate as the bigger models, or are we just talking about sort of a first screen?
It's pretty good, actually. I think that the quality is actually really good. The wand is a little smaller than some of the other wands that we use for more detailed pictures. But you know, if you're just looking for a gallstone or just to see the size of the kidney, or perhaps to check out a thyroid nodule, it'd be pretty good.
And just to do it where the patient is, rather than have them come to the office, is such a dramatic advancement.
Super convenient. And so the next thing that I found that was pretty interesting, it's a radar find teletracking system. It's this little device here. You can actually put this on a patient, or you can put it on a pump, and you can locate items in the hospital at any point. It's sort of like a little homing device. It also can tell if the patient is falling down, because it has an accelerometer inside it. So if there's a sudden acceleration of the device, it warns the nurses that the patient may have fallen out of bed. And then if the nurses need to find a new IV pump, and it's lost, they can't tell where it is, they can just look on their computer. This little device will be a homing device for it, and they can find it more easily, so they don't lose the EKGs and pumps.
Fascinating stuff. Dr. Val Jones, pleasure to see you in Atlanta with all the show and tell. We appreciate it, Doctor.
Thank you so much, Dave. I'll see you soon.
Very good. We'll look forward to it. We'll step away for just a bit, back with more news at the top of the hour, and we hope you'll join us.